I think it's about reach as much as anything else. So the reality is that no statutory services can reach all communities and all their needs, particularly within what has been a challenging financial context since the recession. And I think we've learned that actually faith communities are huge resource bases that have a credibility and an ability to get to people who statutory services may not be fully meeting the needs of. So I think one of the things about faith communities is that they're with people through their whole life course. And of course, in providing health services or promoting health, we're also trying to reach people, influence people, and to provide services to people throughout their life course. So whether it's mums to be and their partners around when they're pregnant and preparing them for the birth of their child, whether it's working with parents of 0 to 5-year-olds and their needs as they start development in life, right through to helping people out of work who maybe have mental health problems, and to older people who are frail and need that sort of more direct support within the community. Faith communities are alongside them throughout that whole journey, and therefore why on earth would we not work with them in terms of as a partner in meeting those needs? So I think most of what we do already through the NHS and through local government is at the local level. And so we've got fantastic examples of projects that we know already exist across the country. I've seen projects in Leeds, in Birmingham, Manchester, but I think they're there throughout the country, where the statutory services are working with faith communities to provide to a local community. So let me give you one example. So in Tower Hamlets, the local authority and the NHS working with the local imams and mosques to deliver dementia awareness and dementia services to the Bengali community, including running a dementia cafe in one of the buildings attached to the mosque. I think the point about working with faith communities is that clearly the very act of faith is a positive and value-based is a decision or set of decisions, and therefore it can fit very well with public health messaging around promotion of sort of positive lifestyle choices, and I suppose a faith base can give some people an additional sort of motivation and rationale for sort of hearing and applying some of those health messages. Obviously, there are plenty of people who don't have a faith who also sort of are motivated in that way. But you can find that in some faith communities, the two things can come together in a way that's mutually reinforcing. I think there is great need out in our communities. There are lots of individuals who are struggling, often quite alone in terms of mental health conditions, or a frail older person who is trying to maintain themselves in the community. And we live in a very sort of fragmented society now, where often people live away from their families, and faith communities provide hubs that can reach out to people, find those people, identify them, draw alongside them, and help to meet their needs, whether those needs are physical, mental, emotional or spiritual, or some combination. So I hope what you will be doing at this conference is actually sharing examples of practice of things that your community is already involved in, and thinking about what more you could do and what more you could offer to the health and care sector, but more importantly to the people who are living around you. No, I think, well, maybe there's one thing I would say, which is one of the things that I hope that faith communities will increasingly do, without in any way losing, the fundamental altruism that lies at the heart of their activity, is to become more professional around the way that they provide some of these services. And what I mean by that is really forming networks, so that what you might be able to achieve in an area is different from what you might be able to achieve in a single institution. And while we never want faith communities to mimic statutory services, because then they would lose their what makes them special, it's possible, I think, at least for some of our faith communities, to do more by being actually better organised and better networked together.